Hi, welcome to Case of the Day. And today is the last case of the week. We're looking at the 63rd case titled Reconstructing and Segmenting Sequestration. You can see this composite image here. It's 29-year-old presented with cough and expectoration. The radiograph shows an opacity in the right lower zone, not obscuring the right heart border. It's in the right lower lobe. It's predominantly in the medial basal segment, complex lesion that we can see here. There's some calcific foci. Whenever we see something like this, we must do a contrast study with an angiogram image. Unfortunately, only the venous study was obtained. But you can see that there is an abnormal vessel arising from the aorta supplying the lesion, which basically makes it sequestration, which we know is most common in the lower lobes, left more than right, and three-fourths of all sequestrations are intra-lobar sequestration. I did an entire series a couple of years ago in case 27, and you can check that out. And also about a couple months ago, I did a longer COD on hybrid congenital lung anomalies where I've touched upon sequestration briefly. But the idea here is to salvage the situation, to try and show the anomalous vessel and the opacity in a better way. So, Osirix, which is what I use for daily reading, gives you a good curved MIP facility. It's called curved MPR, and then you can MIP it, and you can see here that the vessel is very well seen in extending into the opacity into this necrotic lesion. So that does confirm the sequestration. I did want to show it in a 3D, and I tried various combinations, landed up with this. That's the aorta and that's the vessel, and the red is the abnormal opacity in the lung. So that kind of shows that well. But I've been experimenting with TotalSegmentator, and while the new version of Osirix will have a TotalSegmentator plugin, at least right now, the challenge is that it needs 24 GB of RAM. And I have a Mac Mini M4 with 16 GB. So the plugin doesn't work. And so I started using 3D Slicer. And on 3D Slicer, today, in fact, the reason I'm late is because I've spent about 3 hours trying to quickly learn 3D Slicer. And I did do a couple of quick tutorials a couple weekends ago. And then there is a plugin for TotalSegmentator. And again, though Mac Mini M4 has a GPU which is integrated with the CPU, uh, TotalSegmentator doesn't believe there is a GPU, so it takes a little longer. But it does an amazing job. You can see the three different shades of the lower lobe, the upper lobe, and the middle lobe here. And it segments out the rest of the organs, and it doesn't segment the tumor like lesion. So it shows it really well. This is the article that they keep telling you to show, but whatever, this is such an amazing tool. You can even upload your images online and it will do the segmentation and give you the images, but these come as nifty images which are very difficult to open with standard tools, and so it's better to do it through 3D Slicer or Osirix, so you have either JPEGs or DICOM images to work with. So I use 3D Slicer and the TotalSegmentator plugin to get this. And then I said, let's experiment more because there are other lung segmentation tools available, and I wanted to look at the bronchial tree better. And you can see here that there is some truncation of the medial sorry, that's a superior segmental bronchus. You can see the rest of the four here. A little truncation of a couple of branches of the medial basal segmental bronchus, but otherwise you can see upper lobe, middle lobe, left lung, all good. And these are the raw images where they've even segmented in light green a lot of the sequestered lung, which again it believes is tumor. And so that's 3D Slicer with the lung CT analyzer plugin. And then I did a little bit of overlay between the TotalSegmentator and the lung CT analyzer, and that way you could actually segment out the entire or almost 90% of the sequestered lesion, and then look at the rest of the lobes in different colors. So the answer, obviously, this is a case of intra-lobar sequestration, but the whole idea was that the reconstruction and segmentation tools, especially things like TotalSegmentator, have completely revolutionized the way that we can reconstruct and segment things. And these don't take much time. And though the TotalSegmentator takes about 5-10 minutes once you click apply, and that's simply because I have a 16 GB RAM. It is much faster if you have more powerful GPUs. The thing is, you can be doing other things while in the background it is doing the segmentation. So it doesn't really, you're not just going to wait for that. And I think all of this is a game changer. And in the weeks to come, as I'm experimenting with this, when I come across cases where these work beautifully, I will show them. That's my WhatsApp channel. Thank you so much for viewing this. Have a great weekend, and I'll see you next week sometime. Next week, Monday, not sometime.